Begin with Dan McCrory. Dan, do you support universal single payer, mandated private, or some other option to bring health insurance to California citizens?
Yes, I do. I think I made that point pretty clear in my first statement. Single-payer healthcare is a system that is going to save us a lot of money, and it's going to save us a lot of dollars as far as public money for medical situations that the poor are dealing with these days. The state became the single purchaser, will become the single purchaser of pharmaceuticals, and that bulk purchasing power will bring the cost down significantly for pharmaceuticals. Everyone gets a doctor and gets preventive care. Preventative care will solve a lot of the problems that we're seeing in our hospitals and medical centers today. The public planning process determines how we spend our healthcare dollars and controls growth in spending through global health systems. I'd also like to really quickly correct a misstatement by Bob that says he's got the most labor endorsements. That's simply not true. I'm sorry that I have to correct you here in front of everybody, Bob, but that's true. The quality of care in single payer is improved through equitable distribution of resources. You get your choice of physician, you get primary and preventative care, as I mentioned, risk-adjusted budgets that pay the true costs of care rather than the costs of all the administrative fees and things like that. You've got public access to non-confidential data, linkage of health research, and innovation to healthcare needs. Safe staffing ratios, that's been a big issue with our governor and with the hospitals in this state, and return of medical decision-making to medical providers and their patients. When you pay the health tax, the benefits you get are better than any existing health care plan that we have today, and there are no exclusions for any pre-existing conditions or any other health problems. You've got dental care, mental health care, long-term care, alternative and complementary care, and full prescription drug coverage with the health care coverage. Thank you.
Thank you. Thank you, Dan. Stuart Waldman, do you support universal single payer, mandated private, or some other option to bring health insurance to California citizens?
Yes, yes, and yes. I support it all. I support anything that is going to give people more coverage. It is a huge problem, and I support single payer. It'd be great, and I support AB X1, which wasn't great, but it would have given people coverage. We have a problem. We need to incentivize businesses to give their employees insurance, and we need to punish those businesses like the Walmarts who take from the system. I think that, thank you. I actually have a plan. I call it the California Care Plan because you have to have a catchy name. And it's where you set up clinics all throughout the state, and you take people who want to go to nursing school, that want to go to medical school, and you pay for them to go to school. And they can either work in these clinics before they go to school or after they go to school, sort of a national service, but where we give a base level of care to people who aren't eligible for Medi-Cal and don't have insurance from their employers. I think it's a start. I don't think it's the be-all, end-all, but I support everything. Thanks.
Thank you, Stuart. Bob Blumenfeld, do you support universal single payer, mandated private, or some other option to bring health insurance to California citizens?
Yes, I do. Yeah, and I'll add to that as well. I think single payer is critically important, and I will fight for that, and I will not lose sight of that as the goal, and keeping your eye on the ball. Now, the legislature has passed it before, so the will is there in the legislature. The problem is that the governor didn't sign it. So we got 2 years to get rid of this governor and get a governor that's going to sign a single-payer bill, and we need to do that. In the meantime, until we get someone who's willing to sign it, we need to do everything we can to make health care more affordable and more accessible, because it's critically important. Our health care needs are the backbone of what drives us in our society. Now, if anybody out there is worried about the cost and saying, oh, well, it's going to cost too much, we're already paying the cost. We pay more as a nation than any other industrialized nation, both in terms of per capita and in terms of percentage of gross domestic product. And in addition, we're paying approximately 20% on administrative costs. That's just not acceptable. And it's not acceptable that we have 42 million uninsured Americans in this country, 6.9 million in the state of California. That's unacceptable. Insuring the uninsured will, in the long run, prove cost-effective as well. Not doing it is penny wise and pound foolish, because, as you know, when you don't have insurance, people use the emergency room for basic care, which is incredibly expensive, or they avoid preventative care medicine instead in favoring something that will be much costly later on. We're paying for it one way or the other. My wife and I, not too long ago, we had an incident where our daughter, we had to take her to the emergency room. And as anyone who's a parent here knows how scary that can be. And one of the things we found, and she's okay and everything was fine, we had a little CAT scan. But the big thing, I have 15 seconds, is that when we got back, there was an $8,600 bill waiting for us. And all it was a CAT scan. And the reason for that was because we had insurance. And so it didn't cost $8,600 for a CAT scan, but they do what hospitals do. They cost shift it. So the point is, we're paying for it either way. Let's be upfront about it. Let's get a single payer system, and let's pay for it and make it cost effective. Thank you.
Thank you, Bob. Lorette Healy, do you support universal single payer, mandated private, or some other option to bring health insurance to California citizens?
Yes, I do. And if I could wave a magic wand, what I would do is go back to the time when Social Security was being instituted in the United States, and at the same time have created and introduced single-payer health care. I think we would be foolish not to recognize how difficult it will be at this point in time, realistically, to get single-payer health care passed in the state legislature. So what I think the important thing to do as an elected official who will take office in January 2009 is to have a plan that can get us there in a way that will save lives in the interim. I'm jumping ahead, but last year the state of California spent $17 billion on the Iraqi war. Coincidentally, that's what our budget deficit is currently in the state of California, and not only that, with that amount of money we could have insured 7 million people, more than currently are without health insurance in the state of California. So if we really want to start solving our health care problem, we need to withdraw our troops from Iraq and begin to use our money at home. I mean, really, that's really the key. Now, the other thing that I want you to know is that as people go forward, the more money you have, the less of a percentage of your income you spend actually on health insurance. Someone that makes $200,000 spends 3% of their income on health insurance, and someone that makes $40,000 spends about 7 to 10% on health insurance. We need to equalize that. My proposal will include a 3% cap at any time for anyone, regardless of their income, and if they cannot afford it, we will subsidize it. And that's the way that we will do that. The reason why emergency rooms are used as a front line is because we don't have Medi-Cal reimbursements for the smaller preventive types of healthcare needs. Currently, only 37% is reimbursed. What I propose to do is have 100% reimbursement of Medi-Cal for those preventive types of care, which will encourage somebody to go to the doctor when it's a $50 or $200 cost. And that's the way I think we can bring the family doctor back and begin to use our emergency rooms for what they were designed for, catastrophic illness. Thank you.
Thank you, Lorette.